how we do it here is we look first at our legacy systems and our tools here. Can what we have here in our core solutions do what we need? You have to rule those out first. I mean, financially, you just can't buy a best in class. You just can't do everything at once and then hope everything integrates. That creates a long-term maintenance and support challenge that you want to try to avoid.
Welcome to the Big Unlock Podcast, your leading source for insights and best practices on the digital transformation of healthcare. Join host Patty Padmanabhan, CEO of Demo Consulting and best-selling author of Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future, in conversation with healthcare and technology leaders.
Hello, everyone, and welcome back to my podcast. This is Patty, and it is my great privilege and honor to introduce my special guest today, Pamela Landis, Vice President of Digital Patient Engagement at Hackensack Meridian Health. Pamela, thank you so much for setting aside the time, and welcome to the show.
Thank you so much for having me here. I'm kind of excited, and I'll be excited to see what kind of feedback we get from all your listeners. I find that I learn as much from others as in sharing our own story.
Excellent. I am looking forward to the conversation as well. So why don't we dive into it? Maybe you could start by telling us a little bit about Hackensack Meridian Health and the populations you serve.
So Hackensack Meridian Health is a relatively new company, if you think about it. It's the result of a merger of two mid-sized health systems in New Jersey. We are now the largest healthcare provider in the state of New Jersey, a really traditional looking health system where you have hospitals and physicians and other care entities all under one umbrella. We basically serve people from northern New Jersey all the way down the beautiful coastline in South Jersey in the beaches. So from the beach to the north, you'll probably find a Hackensack Meridian Health property. There are 17 hospitals in our network right now, and we actually have a mix of private and employed physicians, and we have 9,000 physicians who are on our staffs.
That's quite a large health system, actually, and it's obviously a very well-known and prominent name in New Jersey. Mm-hmm. But thank you for that background and context. So as VP of Digital Patient Engagement, Pamela, how do you define your responsibilities and who does the role report to?
I report to our Chief Strategy Officer and our CIO here. And so it's a dual report. And when Hackensack Meridian Health created this role about a year and a half ago, I've only been here a year and a half. And I came here from Atrium Health, and prior to that, Henry Ford Health System, where I worked on digital engagement tools and services at those two fine health institutions. When I came here, Hackensack really wanted to say, basically, we know we've got a lot of work that we need to do, and we need to bring together what I would call a digital ecosystem. So it's not just about websites, it's not just about mobile applications, it's not just about a patient portal, but it's all of those things. And it also includes what I call our contact management. And our contact management is more than just taking phone calls. Our contact management is how we engage with our patients and our consumers and our teammates in all forms of online and offline tools. And how do we build this ecosystem underneath so that when you contact us, whether it's through a website or through social media or through a form somewhere, or even through a phone call, we know who you are, we know what your needs may be, and we understand how you want to be communicated with and what answers that we can provide you. And so that's basically what we've been building for the last year and a half. Some things around COVID have accelerated that process, and some things around COVID have actually decelerated that process because you're so busy caring for a surge of COVID patients. Some things you have to put on hold, but other things that you've been waiting to do get unleashed very, very quickly.
Right. And it's often been told over the last several months that what was expected to take 5 years has now been accomplished in something like 5 months, because that was the kind of urgency that COVID-19 created for us.
Mm-hmm.
You described at a high level what we would typically refer to as a digital front door strategy. So it's all of the above, right? Patient portals, it's about patient contact centers, it's really about digital patient engagement, which is
Right.
how you define your role.
It's how we do customer relationship management using modern tools and leading edge tools. And that's really where it's the crux of it. So there's foundationally, you have your EMR. You might have a CRM solution. You might have some business intelligence tools. You might have a patient portal. You might have call center technology. And those are some foundational pieces. And it's upon that what my job is to knit those pieces together to make sure that the consumer experience is seamless. So it doesn't matter what doorway they come in, they understand it, it's intuitive, it's easy to use. It doesn't take, us to do all kinds of education up front. It's just as consumer friendly as using Amazon. Nobody's there yet in healthcare.
Right. Yeah, let's unpack that. Healthcare, as you alluded to, has traditionally been behind other sectors with regards to consumer engagement, digital consumer engagement in particular. The Amazon experience is not there yet in healthcare. And one might see this as the opportunity, really, to up the game in many ways. And you talked about all of the foundational pieces, CRM platform, the EHR platform, call center technology, and others. And then, of course, there's a lot of new solutions that are available to really create these best-in-class experiences that would create the sort of seamless consumer experience that you referred to. So how do you approach this? How do you approach the creation of this experience, and how do you approach it from a technology standpoint? I know it's a two-part question, but maybe walk us through one program where you really transformed the experience and talk us through this.
Yeah. So, you know what? I go back to that whole thing when people say, oh, healthcare is behind. It is and it isn't. And so I've been doing some of this work since 1995. And when we would say, oh, we need to build a website to do X, Y, and Z, and it's going to cost X amount of dollars. My leadership would say to me, at all the institutions I've worked with over the years would say, wow, that's a lot of money. And so I go back to what healthcare did in the late 90s and early aughts was they were really investing their capital in foundational solutions, revenue cycle, EMR, but also clinical tools. Proton beam therapy is expensive. Robots are expensive. And so when we would come and say, we need to do a digital patient solution and it's going to cost $500,000, an executive might look at that and say, and I could get some new 128-bit imaging slicers into my hospitals for that amount of money, or I can hire 4 more nurses for that. Those were hard decisions to make. And so a lot of times what healthcare was doing was investing in some of that foundational infrastructure, true things that they could put their hands and wrap around and understand that they needed right away. And so I give healthcare a big break on that and saying, oh, they're behind. Well, we're behind, but in terms of a digital solution for patients, but we made very strategic decisions that we were going to invest in people and cutting edge technology to deliver world-class care. Those were hard discussions to have. So you have to really make your case. I think, though, in the last 10 years, though, what we have seen is an embrace at the executive level that healthcare and the model of healthcare is changing in a way that we have to now start addressing patient needs in a more front-facing way, in a different way than we have previously. So that's what we're starting to see is the understanding among executives who said, yeah, I get it because I'm using these tools too, and I want to know why my health system isn't as easy to use as an Amazon or another tool. They get that now. They look at the financial services industry who have made a really successful pivot into digital tools. they're saying healthcare leaders across the country are saying we need to do the same thing. So now the work and the emphasis is going into that transformation now. But it's going to take a while because we still have really important legacy tools that we need to optimize to be able to handle the digital patient engagement journey.
In that context, you have, to your point, the legacy investments in some of the core platforms like your EHR system, for instance.
Exactly.
Now you are transforming the enterprise into more of a digitally enabled organization that can serve patients in a very digitally enabled way. And so that requires a whole different set of perspectives on technology choices. So when you look at transforming the patient experience, how do you, from a technology standpoint, do you start with your legacy platforms and you look at what's available and then roll it out and make the most of it? Or do you say, no, wait a minute, I'm going to look at what's best in class out there, and then I'll back into what I think is the right solution for our enterprise? How do you approach this?
Yeah, so how we do it here is we look first at our legacy systems and our tools here. Can what we have here in our core solutions do what we need? You have to rule those out first. I mean, financially, you just can't buy a best in class. You just can't do everything at once and then hope everything integrates. That creates a long-term maintenance and support challenge that you want to try to avoid. So the first thing you got to do that we do, and I say is, for instance, here at Hackensack, can Epic do this? Can Oracle do this? Can Google do this? And if they can't, then it's time to say, okay, are there wraparound services and tools that can integrate easily and have API services available to integrate to an Epic or an Oracle or a Google Cloud platform? So I look at those things first. And so I look at our core solutions. Then we say, okay, if they can't meet it, are there companies that have relationships with those core solutions that have done the integrations? And if not that, then I go to the best in class.
Let me probe that just a little bit further. Now, let's say you've got some native features in Epic, and they will do the job for you. But at the same time, you know that there are other tools out in the market for those same features that will plug and play easily with Epic and have a superior interface or a superior set of features. What do you do then?
Yeah, and that happens a lot more often than people probably understand. You do see much more elegant solutions in that third-party market, and you have to prioritize which one's going to give you the biggest bang for your buck. Can you live with the way Epic Open Scheduling works today, or do you need a layer on top of it from a company like Kairos? And I think that those are individual business decisions that have to be made, understanding what you're trying to achieve, what your goal is. Can you live with the 80-20 rule? Or do you have to say, know what, this one is so important, we actually have to go outside?
And that is a great example, actually, that you just mentioned. And I'm sure that when you look at all the digital engagement touch points that are available to you, you could probably come across several in that category where you have an elegant solution that performs better than a native feature in your EHR platform. Now, let me switch to the back end of the technology infrastructure. All the front end experiences that you describe can work well, work seamlessly, only if you have a robust back end. And that means that you've got to have your data centers, your cloud policies, your LAN-WAN infrastructure, your wireless infrastructure, all of the above. And you mentioned that your role has a dual reporting to the CIO as well as the Chief Strategy Officer. So I imagine you get very involved in a lot of these back-end transformational initiatives that are going to help you deliver the kind of experiences that you seek to deliver. Can you talk a little bit about what are the top 2 or 3 things that you think are absolutely critical, table stakes, for you to be able to deliver the experience you seek to deliver?
Yeah. So I will tell you in the time, so as we're recording this, we're doing our vaccination rollout, and we're doing it online vaccination scheduling. And so we knew that we were going to get hit hard on our websites. And so we, right at the front end, engaged our partners. In this case, it was AWS and Epic and our data center folks to say, okay, we're going to get some traffic that we've never seen before. And quite frankly, all through COVID, we've seen traffic to our external websites at a rate that is unparalleled. So let me give you one example. This time last year, we were getting about 350,000 visitors a month to our website. And now I'm doing about 3 million consistently.
Wow.
And we knew that. And we started scaling up, and we made sure that our back end was able to handle the load. On this vaccination scheduling, we actually understood that, engaged with Epic to make sure that we had as much horsepower to handle all of that as possible. And there are moments during the day when you're trying to schedule an appointment when you get basically the busiest signal on the server. You don't get it often, but you do get it. I'll tell you one example. A week ago Friday, we opened up scheduling at our mega site at the Meadowlands. And we opened up slots for people to make appointments. And we're working with the state of New Jersey and the New Jersey State Police and the National Guard, who are helping us staff that site, but we're managing and operating that site and using our scheduling tools. So we had 35,000 people schedule within 4 hours. It's a lot of traffic to our servers in that time. And it went fast. And so, but the site performed, we were ready for it, we were monitoring it during the whole time, but every single slot was taken within 4 hours. And so it's always about planning and thinking, oh, well, I'll just double it. Well, you probably need to triple it or quadruple it. When you think that you've got enough, you probably don't, and you're going to need more in these particular use cases. I mean, and I think that they're extraordinary and off the charts for a while, but that's what we've learned over the last year.
Oh, that is such an interesting anecdote here, Pamela. 8 months ago, everyone was talking about having to deal with a 10x and 15x increases in telehealth visits and what kind of challenges they represented for IT executives trying to scale up the infrastructure to make sure that the line doesn't drop, you're able to log in, you have high quality video, and so on. And now we are talking about vaccines. So it's a very interesting change in tone, if you will, from talking about dealing with COVID-19 related virtual visits and now talking about vaccines. And I imagine that through these experiences, the ability to scale and also the potential for emerging technologies, specifically cloud, since you mentioned AWS, to help scale and do it in a way that you're able to meet the expectations of your constituents. I think that's a fantastic anecdote. So switching back to the digital front doors and switching back to digital patient engagement, you've been here for about 1.5 years, but you've been doing this longer. So just looking at your Hackensack experience, what does your data tell you about the adoption levels for digital engagement tools among your patient population? And what do you sense are the change in consumer preferences today?
Yeah, so here's one piece of data. We saw our MyChart usage in terms of activation. You always want to have people use MyChart as much as possible, but we were not unlike many health systems across the country where we weren't, adoption wasn't as high as we wanted to be. In the year of COVID, we increased our MyChart activation 68%. And that was without doing one iota of marketing.
How does that benchmark with best in class in your view?
So I would say that we were under best in class. We were probably in the bottom quartile of health systems around the country. When I look at some of the best ones around the country, like a Kaiser, or somebody that has very high adoption rates, or a Providence St. Joseph's out there in Seattle. And I would say we're probably right there in the top quartile now. We're not best in class, but we're getting there.
Well, that's significant improvement.
And if you think about it, Patty, we didn't tell anybody about it. It was just consumer demand drove it. And that's where I think that we have a lot of learnings that have come out of this. People are now ready. They get it. They're ready. Another anecdote was, don't ignore some of your, less sexy, but still important tools like your phone lines. During this vaccine, when we started doing vaccinations, one of our phone lines, one small example, one phone line would normally get about 150 calls a day. And it was like, to find a doctor, and we want to, hook people up to the right doctor in their area. That phone line went from 150 calls a day. It's now running 14,000 calls a day. The demand there around healthcare services is exploding. And it's basically about the vaccine. Our challenge will be is how do we keep and capture those people after people are vaccinated? How do we make sure that they stay with us to stay in care, that we start not only just vaccinating them, but caring for them through their life?
How much of a role does the profile of the population that you serve play in the adoption rates? And even within New Jersey, do you see differences between one part of your area versus another?
Yeah. So where I'm seeing the difference is, if we're thinking about the digital divide, here are two areas that I worry about in the digital divide. And I don't have great answers, and I would love for someone to give me the great answer. How do we help people where English is a second language, where they're not native English speakers? Too much of our work is still in English only, and that worries me and, quite frankly, pains me in some ways. And the other one is for those that are 75 and older, where digital adoption is lower than in other age groups. It's still pretty decent, but it's not where it needs to be. And when I think about the people who are most at risk having serious complications from COVID, it is people 75 and older, and it is people from minority communities and people of color. I need to make sure that when we build these systems, we address those needs too.
It's interesting you bring that up. One of my recent guests on this podcast is the CIO of a health system in Southern California that serves Medicaid populations that are mostly Latin communities.
Right.
And there, one of the things that you mentioned was very relevant in their context, which is the bilingual capability to whenever you turn on a digital solution. And of course, the one thing that in their case they had to deal with was because they were serving a low-income population, they had to really make some of their digital solutions backward compatible with earlier generations of devices. And
sure.
And this was something that was counterintuitive to me. Maybe we are on the latest version of iPhone, many of us, but their population is on versions that are 2 or 3 or even earlier generations. To make healthcare inclusive for them, one of the big things about the digital divide is to make sure that the solutions reach everyone and not just certain parts of the population. That's what I heard from that conversation. It sounds like that's what you're saying too.
Yeah, I am seeing the same thing. And, a lot of folks say to us, and I look at the data in the state of New Jersey, they assume that those people of color or other groups don't have access. They might not have broadband laptop access in their homes, but they certainly have phones. And here's the other sensitivity. We need to be sensitive about how much we're using in terms of their data plans. And I need to make sure that whatever we deliver is as efficient as possible so that we're